everyone. Just wanted to do a quick update about microcurrent and your eyes and what you can expect, what kind of changes you can expect in your eyes with microcurrent. Microcurrent is not magic. It is just microcurrent, which means it's about 1/1,000,000th of an amp. It's a tiny, tiny current that the body recognizes and can use as its own. The kind of microcurrent we use in facial rejuvenation mostly uses the L wave or the square wave microcurrent because it has been most proven to firm or to lift muscles. So we want that lifting effect. They also use microcurrent in like CES, cranial electric stim, for depression, that sort of thing. But that uses a more spiky, or like I think they call that a V wave. I don't know what they call that, but it's very spiky and doesn't look open like the square wave does. So so microcurrent uses the square wave, and that's when what's most proven to lift the muscle. And so if you come in and your eyes are so you have a lot of puffiness, and I live in Austin, Texas. I have a ton of allergies. I've always had allergies. And so one of the first things I notice, like if I use a heavy cream or if the mold count is really high or something gets in my eye, it's just like, And so I'll do a microcurrent treatment, and if I can't do a full treatment, I'll just do a quickie where I hold one probe here and I just go around the eye, and that sort of wakes up the whole eye, or you can hold it up here, and it wakes up the eye. And it's also great for tired eyes, puffiness and all that sort of thing. A quick note about lymph. If you try to do microcurrent on your eyes and you've got pockets of lymph, and if you have bags underneath your eyes, you probably have quite a bit of lymph. There's a lot of people who have this little pocket here, which I'm always fighting. In Chinese diagnosis of the face, that is considered the spleen. I believe it's on that side. And so people will get these little pockets, and for that I will use lymph drainage, and I have a new machine that really helps suck all that out. It takes 4 to 6 treatments, sometimes a few more, but it does get that out. So if you try to do microcurrent in an area that has a lot of lymph, you'll get some lifting, but what you're going to find is a lot of puffiness, and what I found is if I do microcurrent on eyes that are full of lymph, they actually look worse than they did before I pass, the wands over, because now we have lifted and toned muscles surrounded by lymph. So really, you need to go in and clean that out. And when I use my gloves, I'll go in and do manual lymph drainage. It's not as great as my new vacuum therapy machine or my power cupping machine, but it does help with sort of a quickie lymph drainage. And basically what I do is I just sweep out and down, because we have lymph nodes here. The main lymph nodes in the body are here beneath our clavicle, but and you can start by draining this area and get this activated before you ever drain anything through here, or you'll get like a lymph traffic jam. But yeah, so you'll just sweep, make sure your finger is wet, or you have a gel mask on, something to conduct the microcurrent, but make sure your finger's wet and just sweep. It's a very light movement, and you may have to do this if you got a lot of lymph. You may have to do this 100 times, but if you do it with a lot of repetition, you'll find that the lymph will start to remember how to get out, because sometimes this lymph gets so stagnated and it gets so stuck there that it just kind of forgets where to go. And so we need to remind it, here, on out, move on out, and then I'll hold here and move it on out, move it on out. And this is very basic, manual lymph drainage. There's all these classes you can take, and it's very quite complex. But I do this very simply to start. And so if you want better microcurrent results, you really need to start with some lymph drainage if you have puffy eyes. And then you just go in and do your regular movements. You know, you pinch here, you do these. I like to lift the frontalis, because without doing that, you're not going to have, you know, the lift through here. So if you decide to go and get microcurrent treatments from an esthetician or somebody else, I recommend going to an esthetician, because we understand the muscles of the face a little bit better than, say, somebody else who does microcurrent, maybe at a chiropractor's office, or I don't know. There seems like they're doing it everywhere anymore, but really go to somebody who knows the muscles of the face, who knows what they're doing, who knows about lymph drainage, who knows their microcurrent machine, and knows who's good, because microcurrent right now is exploding, and there's a lot of misinformation about microcurrent right now, and there's a lot of people doing that quite frankly don't know what they're doing. So make sure whoever's doing your microcurrent is qualified and knows what they're doing. Anyway, microcurrent around the eyes, you can expect a nice lift. When you do this, you can expect your eyes, after a session of microcurrent, or after a series of microcurrent, to be back up there, if you remember that, and to be depuffed, and your vision might even be better too. I've heard that. So if you have any questions, pop me a comment up here. I'm not real good at answering emails anymore because I get so many. So pop a comment up there and we will get you some answers. Thanks for tuning in. Please press like if you liked it and add some comments. Thanks.